Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever wondered about Weil's disease, a severe form of the bacterial infection leptospirosis? Not quite a household name, but it's a serious condition indeed. This stealthy disease can cause major health problems and even prove fatal if not treated promptly. That's why it's so important to understand what Weil's disease is, how it manifests, and how it can be prevented and treated. Knowledge is power, and in this case, it could be a lifesaver. Stay tuned as we unravel the causes of Weil's disease. Dive into the causes of Weil's disease. This potentially serious condition is caused by a specific strain of bacteria known as Leptospira interrogans. These microscopic invaders are typically carried by animals, with rodents being the primary culprits. Rats, mice, and other small creatures can carry the bacteria without showing any signs of illness themselves, making it easy for them to spread the disease. But how does this bacteria make the leap from animals to humans? The answer lies in our environment, specifically in contaminated water or soil. When an infected animal urinates, it can leave behind Leptospira bacteria. If this urine contaminates water sources or soil and a human comes into contact with it, there's a risk of infection. This is especially true if the person has any cuts or abrasions on their skin, or if they swallow the contaminated water. Now that we've learned about the causes, let's move on to the signs and symptoms. Uncover the signs and symptoms of Weil's disease. This infectious disease often starts subtly, masquerading as a common flu. It's not uncommon for someone to experience an onset of fever, chills, and muscle aches. These initial symptoms can be misleading, as they are quite common and can be easily mistaken for other illnesses. But as the disease progresses, the symptoms become more severe and distinct. The next stage of Weil's disease brings about symptoms that are far from ordinary flu. A person might develop jaundice, a condition that causes yellowing of the skin and eyes due to liver damage. Kidney failure is also a possible complication, leading to decreased urine output and fluid retention. Some may even experience bleeding in the lungs, a severe and alarming symptom that requires immediate medical attention. Recognizing these symptoms is crucial, but how do doctors diagnose Weil's disease? Discover how Weil's disease is diagnosed and treated. This bacterial infection can be tricky to pin down, but there are reliable methods healthcare professionals employ to detect it. Typically, diagnosis involves blood or urine tests. In these tests, they're looking for the presence of the Leptospira bacteria or antibodies produced in response to the infection. Now let's talk treatment. Once a diagnosis is confirmed, antibiotics are the frontline defense. They're used to kill the bacteria and halt the progression of the disease. In most cases, doxycycline or penicillin is used. However, the specific type of antibiotic may vary based on the patient's overall health and the severity of the infection. For those with severe symptoms, more comprehensive care might be necessary. This could involve hospitalization for supportive care. This might mean intravenous fluids to combat dehydration, medication to manage pain and fever, or even kidney dialysis in extreme cases. It's important to note that early treatment is crucial. The sooner antibiotics are started, the better the outcomes tend to be. So, if you suspect you may have been exposed to the bacteria causing Weil's disease, seek medical attention immediately. Treatment is key, but prevention is always better. But how can we prevent Weil's disease? Explore how to prevent Weil's disease. It's not as difficult as you might think. The key is adopting a few simple habits that can make a world of difference. Start by avoiding contact with potentially contaminated water or soil. This is especially important if you're into activities like camping, farming, or any outdoor pursuits, really. Next, consider using protective clothing. Gloves, boots, and waterproof garments can help minimize exposure to contaminated environments. Now, let's talk about rodent control. It's crucial. Remember, rodents are the primary carriers of the bacteria causing Weil's disease. Ensure your home and surroundings are free from rodents by employing effective pest control methods. Vaccination is another preventive measure. Although it doesn't provide complete protection, it can reduce the severity of the disease if you do contract it. Remember, prevention is the best way to stay safe from Weil's disease. So start implementing these measures today and take control of your health. Revisit the key points about Weil's disease. This bacterial infection, primarily caused by exposure to contaminated water or soil, manifests through symptoms like fever, chills, and muscle aches. Early diagnosis, usually through blood tests, is crucial for effective treatment with antibiotics. Prevention hinges on avoiding risky environments and taking protective measures like wearing appropriate clothing. So stay informed, stay safe, and remember that knowledge is the first step to prevention.